My name's Nazi and I work at Littleborough Dental Practice, so some of you might be patients there. Yeah, I know. Yeah. So I'm going to talk a little bit about what my job involves, alright? So I graduated, or I got my degree in 2005 from Liverpool University. And after you do your 5 years of training at university, you have to do 1 year of further training, and you have to do that training in a dental practice. I've been at Littleborough Dental Practice since 2007. To become a dentist, you need really good GCSE grades, so you have to do really, really well, and that's just because there's so much competition out there now. Lots and lots of people want to do dentistry, and you have to be sort of really good with your grades, getting grade A's in your maths, in your sciences, in your English. They want a lot of grade A's. Once you do your GCSEs, then you have to apply to college and do A-levels. The A-levels that I studied was biology, chemistry and psychology, but the requirements have changed a little bit. So they definitely want you to do biology, they definitely want you to do chemistry, and then you can do maths, physics. I think they're accepting computers and IT work now as well. But you'd have to look at that closer to the time when you get to the age of applying. Alright? Again, they want really good grades in that as well, so they want grade A's. So really from the start, from your GCSEs, it's grade A's. Going on to A-levels, it's trying to get grade A's and B's and as well. And the reason being is there's just so much competition. So for one place at dental school and university, they usually have at least about 50 to 60 people applying for that one place, and there's usually about 70 places at the university. Some of the universities that do the dental course in England, Glasgow do it, Liverpool do it, Manchester, Birmingham, London, these are just a few, and again they have their different requirements. So some of them will say yes, you must study A-level maths. Some are saying, well, we're not really too bothered if you don't study A-level maths, but you can replace that with physics or you can do another course. So you'd have to again look at the requirements closer to the time and then base your A-levels according to what the university wants. Some of the skills required in my job. So you have to be really good with your hands. If you're a clumsy dentist, going to be making lots of mistakes and not very many patients are going to want to see you. Alright? So really good with your hands, really good with artwork, really good with sort of intricate things. You have to be quite hardworking. So again, from your GCSEs you have to be aiming for grade A's and B's at least. Okay? You're going to have to work with people. You're going to have to be good with your communication skills, and you're going to have to be good with listening as well. With the communication skills, a lot of patients come in. I see around about 45 patients a day. Some patients come in, they see me and they're in pain. Some are not happy with the way their teeth look. And it's just going through them patients, listening to what they have to say, and basically working with them to try and improve their mouth and oral health. So what do I come across in my job? I come across all sorts. I come across people that have really good, nice clean teeth, nice clean mouths, they're brushing twice a day, they really look after their appearance. There's some patients that I see that don't have such nice clean mouths. They have a lot of decay, they're not brushing very well. I treat a lot of children, we treat a lot of elderly people and people who are very nervous, because we get a lot of patients who don't like coming to see us. Some of the work that I do lots of fillings, do lots of extractions, so I take a lot of teeth out. We do something called crowns, we do braces, we do false teeth. We do a lot of cosmetic work, we do teeth whitening, and I am also involved in teaching young dentists as well. So when they come out of university, I have to look after them for about a year or so before they're qualified enough to start seeing lots and lots of patients. So these are some cases that I come across. So you'll see some patients that have really nice clean mouths, and you'll see some patients here that haven't brushed their mouths for literally weeks. You'll see some patients here, they are not looking after their diet. Their diet's full of lots of sweets and chocolates and sugary foods. These would be teeth that we'd probably end up taking out, which would then give us a mouth that looks like this, where there's no teeth at all. So for this here, we'd end up making some false teeth so they'd be able to eat and drink food. Why I chose this career? It's very interesting. Each new patient that comes to see me, it's a new case. Everybody has a different story to tell. And I'm in that position where I can improve their smile. So if they come to me with mouths that are quite grotty, I can work with them to try and improve them from going from one state to the other. And after that, I can really see an improvement in their confidence as well. So each new patient is basically a challenge. You're getting them out of pain. It's a hands-on job. I work Monday to Friday from about 9 till 5 o'clock. You can work weekends if you like. There's also the emergency out-of-hours service as well. After 5 years of training at university, it's one of the careers where you're actually guaranteed a job. So there'll be some students where they'll go to university, after they get their course and their degree, they're looking around for a job. With this, you do your 5 years at university and you're guaranteed a job straight away. So you won't find a dentist without a job. All right? And you can earn from £50,000 a year, which is a lot of money for somebody who's just done 5 years of university. You're earning that much money, there's the potential for yourself to earn more. You can specialise in other areas as well, so you can go on to do brace work, you can go on to do cosmetic work. So there's lots of other different areas as well that you can go into. So it's not just all filling, extracting teeth. There's lots of other areas that you can go into. So my dental nurse is going to talk to you a little bit about her job and what she does. But yeah, without her I wouldn't be able to do my work. She works very, very closely with me. So yeah.
So I'm still studying. I've been doing the course for about 18 months. I'm nearly qualified. I'm with Bury College. You would need C's at least in English and maths, and you would only need to go to the college 1 day a week, and the rest of the days you can work in a practice.
Whilst she's doing her apprenticeship, she gets paid for actually learning on the job. So you're almost full-time now at the practice? Yeah. So she's almost full-time at the practice with me, and whilst she's learning her dental nursing, she's getting the training with me as well. So she'll be helping me with mixing materials, getting ready for the next patient, bringing patients in, calming patients down. So she does a lot to help settle the patient in and getting things ready.
Thank you very much. Would you like to give them a round of applause?